Hi, my name is Lauren, and I am returning now after 5 weeks since I last saw Dr. Jody. I saw him for 5 consecutive days, and now I've returned and have repeated treatment for 3 consecutive days. I'm here to report some good news. I came in with my eyes watering. Whenever I would relax, they would burn and then water as if I had onions with me. And that has pretty much altogether stopped. Occasionally I get a tear or two, but the amount of tears that I had before was tremendous. It was as if I was bawling, like runny nose, everything. And that is because my autonomic nervous system is now balancing out. And I was stuck in sympathetic mode, so fight or flight, and now I am, now my parasympathetic is now coming into play and calming my system down, and I'm getting rest, and my system is now enjoying the benefits of that. I have been wearing a dental appliance for the last 16 years after I had a jaw surgery when I was 15 to actually prevent TMJ, which I now developed. But anyway, I had a dental appliance that I had to wear every night in order to hold my jaw in place. And if I didn't wear it, my jaw would pull backwards into the back of my head, basically, and I would lose motion in my joints. Dr. Jody worked with me to slowly wean off the appliance. So I lessened each night. I slept with it less, and I did applications on my own that helped my brain to coordinate and the muscles to relax and to for my jaw to release, or so that it would function without the appliance. That after about 2 weeks, I stopped wearing the appliance altogether, and I'm still not wearing the appliance. I've returned, and Dr. Jody has treated me for my TMJ. One joint would move and the other wouldn't. And now we have the other joint moving. So my jaw is now opening and closing correctly, and I'm not wearing my appliance. So that's amazing. Also, I've learned the relationship between my SI joint pain, which I've had for 5 years, and my jaw, and that they both, the SI and the jaw joints, are on the same neurological pathways. And so I've always actually wondered if they're related, because sometimes I would not get enough sleep and my jaw would be locked, and then my SI joint would flare up all of a sudden. So that was an interesting connection that I learned about, that now that I am rebuilding the pathways that connect both of those the joints through the trigeminal nerve, then I'm now becoming stable. And overall, I felt a lot more stability in my balance, such as when I would go to lean over and shift my weight. Before, I always kind of felt like I was still teetering, and now, for like the first time since I can remember, I have the sensation of shifting my weight and then rebalancing really strongly on from a different position. Also, I've had trouble with my posture forever, and after actually 5 days of treatment with Dr. Jody, I noticed that my posture just straightened up, like without effort. So that was a pretty cool bonus. And I had a gap between my teeth that my orthodontist said was a result of being in sympathetic mode, pushing forward. And that was very noticeable. People would comment on the gap, and it was a conversational piece. And that closed up within, I'd say, a couple of weeks. So there's been a lot of noticeable improvements, and I'm feeling more stable than I have, and as long as I can remember. And I'm excited to see how my body continues to heal and stabilize as I continue treatment. Well, one of the things we worked on this week, actually, this week we worked on my, the fencing reflex. Okay, so this week we worked on the fencing reflex, which is when, if you lose your balance, how do you regain your balance if you're falling backwards? And so Dr. Dade would simulate that by pushing me a little bit so that I would lose my balance with my eyes closed, and then watch for what the reflex was. And before, I had a tendency to have festination, which is taking very many small steps backwards. That's common in Parkinson's disease and other neurological disorders. And so when we initially started, that was my reflex, was to totter. And through the applications, simulating on a machine that simulates me falling forward slowly, it simulates the part of my brain that then goes into effect to help with the reflex. So by on the first day, actually, I developed the reflex to put my dominant foot backwards and brace myself. And that's what we were looking for. And before that, I didn't have a way to stabilize myself quickly. It was like my brain lagged, and then it would shuffle. My body would shuffle, and there was no dominant side. So the definitely that I haven't even had enough time to really experiment and see how that goes. But I'm definitely looking forward to being more stable, because now that those pathways have been created and my brain knows how to now I can communicate to my muscles how to have the reflex to support myself. I would say the feeling of becoming more integrated is as the system functioning. I think function is the best term. Before I saw Dr. Dade, how I explained my body was, it's not functioning. It wasn't functioning. I felt like I put so much energy into it and I got no energy out. I got tired easily, and I constantly had joint problems on specifically my right side of my body, my ankle, my hip. I've had problems with my arms and my wrist, my neck. And I would wear braces all the time. So I had a dental appliance. I had an SI joint belt that held my joint together whenever I would be sitting longer than an hour. So car rides, airplanes, everywhere that belt came with me. If I had job that I had to sit down, that I was wearing that belt under my clothes. Constantly injuring my right ankle, in and out of an ankle brace all the time. So I always had felt like I was always strapping myself up to keep myself together, and even then it just didn't feel like I was functioning. And so yeah, I guess the best way I could describe is I'm starting to not feel like I'm falling apart. The pieces are not on their own doing their own thing, but that they're actually getting in line, and my body's beginning to function as a unit. Dr. Dade is different from other doctors, first of all, because he was able to evaluate me and diagnose what was going on in my body. And that's something that no one has been able to do all these years. And I've wondered why my eyes are constantly watering, and why my SI joint never healed, and why I'd injure myself and the injury would never heal. It was become a chronic problem. And so doctors would try to help me, but there was always a mystery. And so I would say first of all, Dr. Dade, when I met with him, he made this enormous list of things that are wrong with me, which completely overwhelmed me. But at the same time, it was that's me. I'm dealing with every one of those things. And I just started crying, because it was no one has been able to see that and repeat it to me. I didn't even tell him all those things, and he was able to point them all out. And when he pointed them all out, he's saying as well, we can start working on these. So there's definitely hope. That's what made him really different to me, was that I felt like he was the first doctor that really understood what was going on through my body and what I was experiencing as well, like how hard it was to live in a body that's not functioning and do a job and make a living and do your work and try to be functioning, but doing it with like a handicap of a body that just is not giving you the support you need to live your life. So that was the first. And then I would say just the way Dr. Jodie works is different than other doctors. Just the science behind it is different than you'll hear from most doctors. But even more than that is the time he spends with each patient and the intensity of it, that he stays with you. So you'll come in for 5 days to start or so, and he will stay with you the whole time and answer any questions and talk to you about your lifestyle and talk to you about things that would be good for you to do mentally and socially. And he just kind of takes you under and then addresses everything in your life, including your symptoms and your treatment. So he's a good doctor. Yeah.